Hi, everyone. If you're just joining us, this is the NPRQI Monthly Forum. If you haven't already, I'd like to invite you to enter your name and affiliation in the chat. We're going to go ahead and get started. And just for awareness, we are recording this session for those that are not able to attend the live session. So again, thank you for joining the NPRQI Forum. My name is Lisa Inohasa. I'm the Senior Program Coordinator for the NPRQI program. A few acknowledgements before we get started. NPRQI is supported by the Health Resources and Services Administration of the U.S. Department of Health and Human Services, as well as the Toyota Way Forward Fund. The contents of today's presentation are those of the authors and do not necessarily represent the official views, nor are they an endorsement by HRSA, HHS, or the U.S. government. The University of Texas at IRB has reviewed this initiative in full and has determined that the project is exempt from human subject research. So before we dive into our content today, I wanted to introduce Michelle Mogling, who will be co-presenting with me today. Michelle has extensive experience as a former pediatric ED nurse and quality improvement specialist. She's currently affiliated with UH Rainbow Babies and Children's Hospital in Cleveland. There she serves as the coordinator for the Rainbow Community Pediatric Emergency Services. She's also the co-lead nurse for the hospital and subject matter expert of the disaster domain, housed within the EMSC Innovation and Improvement Center. Additionally, she is the senior project manager of the ASPR COE Region 5 for kids. So as we can see, not all heroes wear capes. Michelle, I'm going to hand it over to you to do a brief introduction of the importance of pediatric readiness.
Okay, thank you. And thank you for the introduction. We know that pediatric readiness is important. This has been shown with multiple studies. The National Pediatric Readiness Project, or NPRP for short, empowers emergency departments really to improve their ability to provide high quality care for children, also known as being pediatric ready. This project is led by the EMSC program in partnership with the American Academy of Pediatrics, the American College of Emergency Physicians, and the Emergency Nurses Association. The NPRP offers free open access assessment opportunities, practical resources. We have a whole toolkit dedicated to pediatric readiness that we are actually starting to look at and really update. We've heard from a lot of people that they want tangible items in there and not just articles to read. So we are starting that process of evaluating and working on that. One of the most effective ways to act on your NPRP findings and improve pediatric readiness is really designating a pediatric emergency care coordinator or a pediatric champion to lead and sustain these efforts. This role does not have to be a full-time role. Ideally, you would have a counterpart. You would have a nurse and a counterpart provider working with you. So you would have two PECs, which really leads to the most improvements that you can find. With the research, it gives you like a double-digit increase in your national pediatric readiness scores. High levels of pediatric readiness in the EDs are associated with the potential for 76% lower mortality risk in children. And we could save up to about 2,100 children each year across the United States. So raising a hospital's pediatric readiness score could mean the difference between life and death for a child in crisis. Next slide. So 80% of children, we know that 80% of children receive emergency care in general emergency departments, not in pediatric or children's hospitals. However, many of these EDs have low pediatric volumes, which makes it harder for them to prioritize pediatric specific training, equipment, and systems. Pediatric readiness means really having the people, the processes, and resources in place to provide high quality care to children. Excellent.
And then I'm going to dovetail into your conversation about high pediatric readiness and really kind of talk about the role of NPRQI as it pertains to high pediatric readiness. So I see some familiar names on the webinar, but I also know that we have some folks that are new to the quality improvement space. And so for those that are not familiar with NPRQI, it is an innovative quality improvement pediatric readiness tool that it's free. It's a self-paced platform that enables EDs to securely measure, benchmark, and enhance their performance on the most essential pediatric care processes. I really want you to think about NPRQI as a framework and a toolkit that supports continuous quality improvement at your ED. NPRQI was specifically designed to really inform and empower frontline ED staff to help them provide the best pediatric care possible in an emergency. And again, just to reiterate the message that Michelle was making earlier about pediatric quality improvement, in that quality improvement activities are really the leading driver of pediatric readiness, which is associated with improved clinical care outcome for children in your ED. And if you have dabbled in quality improvement, you're new, maybe you're more experienced, you've really probably have started to begin to understand that you really can't improve something that you don't fully understand. And so quality improvement is really all about using data to inform meaningful and actionable change. And so NPRQI really simplifies quality improvement work by offering an established set of metrics, customizable dashboards, and support resources that really enable EDs of all pediatric patient volume sizes, even if they have no quality improvement experience. NPRQI really helps EDs to identify gaps in the quality of the care so that they can really be certain that the efforts they take really improve on making a difference in their pediatric patients. So this slide is just an overview of the implementation stages of NPRQI. With NPRQI, you really do get a path to better pediatric care through accessing a free, secure web-based platform. There, you're able to capture pediatric patient encounter information. You get a visual display so that you can really kind of measure your current performance. It gives you the opportunity to really kind of reflect on that performance. You can benchmark against other similar pediatric patient volume sites. You can benchmark against the national average and really use this data to help align quality improvement strategies, not only with high pediatric readiness, but also with your organizational goals and objectives, so that you can really use that information to improve and help drive pediatric performance results. So using NPRQI, EDs can really select from 7 of the most common clinical conditions that include 28 nationally vetted clinical quality measures to assess their performance and also benchmark against similar pediatric patient EDs, as well as the national performance. NPRQI is unique in that it's really helping to close the gap on a missing piece of information. It's really a tool that helps EDs truly understand what's happening with the individual patient encounters in an ED and really understanding the actual quality of the care that's being provided in your ED as well as EDs all across the United States. So Michelle, I'm going to hand it back over to you, where you can share some more information about elevating the role of a PEC in your ED.
So, quick question for everybody, and you can use the chat for this. Are you the PEC in your ED? How many of you guys are the pediatric champion in your ED? Okay, good. We have a few. Great. Okay, we can go to the next slide. It's awesome. Looks like everybody is. So
Nice.
what is a pediatric emergency care coordinator? You may know this, or you may think of it as in a different realm, but it's all good. PECs are often referred to as pediatric champions, really to help ensure that your ED is ready to care for children and every day, any time of day. You serve as really leaders and advocates for integrating pediatric needs into everyday operations. Some of the responsibilities for aligning the ED with the National Emergency Care Guidelines as well. The role can be adapted to the setting, the size of your staff, and the resources available. As I had mentioned, both a nurse and physician PEC or advanced practice provider PEC are recommended for all EDs. Overall, PECs are vital as they work to elevate pediatric care quality, promote staff readiness, and improve pediatric patient outcomes. Next slide. So why is this so important? In 2006, the Institute of Medicine recommended that hospitals appoint coordinators for pediatric emergency care. Having a PEC is recommended by national organizations such as EMSC, ASAP, American College of Emergency Physicians, AAP, American Academy of Pediatrics, ACSCOT for trauma, the ENA, and the NAS, and much, much more. Hospitals with PEC show potential for higher pediatric readiness scores. As I mentioned earlier, if you have a nurse and a provider PEC, your national pediatric readiness score can increase by double digits. Greater compliance with pediatric emergency care protocols, and better patient and safety outcomes. Next slide. Some of the PEC responsibilities, and these can vary depending, like we mentioned, on your size and your staff of your ED. PECs help ensure that staff are trained and competent in pediatric care. This starts really at onboarding and includes age-appropriate considerations. It also includes having pediatric considerations in triage. EDs have the right pediatric equipment, supplies, and disaster plans, but not only having that equipment and supplies is necessary, but staff need to know where it is and how to use it. Pediatric QI efforts are prioritized and coordinated through the PEC in order of what they feel is the most needed. It could be based on a case you had that may take priority over something else. PECs lead by really promoting best practice across the clinical and administrative teams to assure high quality pediatric care. They support effective communication, patient safety, and really support and encourage family-centered care. And then they also facilitate interdisciplinary collaboration. Next slide. So how to designate a PEC and provide them support. Really identify, if you don't have a PEC, which I think everybody here does, So I'm just going to go through this fairly quickly, is really identifying an existing pediatric advocate or champion on staff. It doesn't have to be one person. Some of the hospitals in our system have groups of PECs because they found it easier because there's night shift, there's day shift, there's middle shifts, or people can just put in as much time as they can working together. And that helps them with, I think, more support as well. You can create a formal jobs description with roles and responsibilities with the help of managers. Secure leadership support, and ideally have a little bit of protected time. It'd be great if it could be a full-time role, but we know sometimes with the way healthcare is and the challenges with support and budgets, just getting even a few hours a week to work and do your PEC role and go over some cases and review some charts and help staff become more comfortable caring for kids. Also recognizing contributions and integrating into a broader QI and training efforts. Most hospitals have a QI department, and you can work with them to even to help you learn more about QI or look at what some of the metrics is the hospital's already looking at in consideration for pediatric patients. Consider co-designing a nurse PEC and physician, like we mentioned before. Next slide. So we have made our first adventure through a PEC module series. This was developed by the EMSC Innovation and Improvement Center to help PECs succeed. This is a free self-paced online learning series. It's ideal for new and experienced PECs. This goes over orientation to the PEC role. We do have some real world examples, practical applications. We have some tools in there, how to reflect and set goals for yourself. And we do go through all of the domains of pediatric readiness. I think we have 3 modules on really administration and coordination because there was a lot of information that we wanted to share through that. And then each of the other domains have their own modules. These modules are 5 to 15 minutes. They, I think, are very well done. There's some videos in some of them with people giving their reflections. It also has some tools, like I mentioned, there's resources. And you do get a certificate of completion. This is not a CE module. One of our goals in the upcoming 1 to 2 years is to really create a more of a course for PECs that does include CEs. And these can all be found on the EIIC. Hopefully can we put that in the chat, the link to that page? That'd be awesome. Thank you. Next slide. That's me.
Yeah, so we wanted to just kind of pause here for a minute and allow some time for any questions that folks may have, either about pediatric readiness, about the PEC position, how to get a PEC role started, anything about NPRQI. This is a great opportunity to ask questions. I think by the mere presence that most of you all are PECs and are on this webinar, you guys are pretty well versed in pediatric readiness and quality improvement. We do have some additional links that we can post in the chat for the National Pediatric Readiness Project in case you have questions about that. You may be aware that there will be an assessment, the Pediatric Readiness Assessment coming up in 2026. You can check out the website. There's actually a brief assessment that you can take that's kind of a precursor to what's going to come for sites that are really wanting to get more involved into pediatric readiness. They can do like the mini assessment where they'll get some initial information back, but the really true big assessment will come out, I believe, March 2026. But The NPRP website has some great information and resources for folks around pediatric readiness. There's a checklist, there's a toolkit, and I think we also posted a link to the PECC modules that are available to folks. So you all are welcome to enter any questions in the chat. You are free to unmute yourself if you would like and ask questions. And if there are no questions now, we can just kind of continue on with our information, and we also have time at the end for questions as well. So I really wanted to share some more information about how NPRQI really can support your ED. So along with the data platform and the visualization tools, we really kind of incorporate the concept of the importance of quality improvement. And so Michelle had already talked about, 85% of children are seen in general EDs. When you're implementing quality improvement, you can have the potential of reducing the mortality risk by 76% of those kids that are actually treated in EDs with high pediatric readiness. And really just kind of understanding that having the data really helps you to make meaningful and actionable change to performance. So what's really nice about the NPRQI program, in addition to the platform, is that we really kind of go above and beyond that. NPRQI was really designed for low pediatric patient volume sites, low resourced sites. That's not to say that other pediatric patient volumes can't participate. We welcome all emergency departments, freestanding EDs to participate regardless of pediatric patient volume. But one of the other value adds that we provide, because many of these sites that we work with do have little to no experience with quality improvement, we really enjoy visiting with them through our office hours, which is really a technical assistance platform, a coaching platform where we will work with sites one-on-one to help optimize chart sampling strategies, really dive into how they can streamline their data entry process, take a look at their performance data that they have collected and really help them unlock insights from that information. Identify high impact areas of focus, so specific areas that seem that they could really benefit from doing some specific quality improvement interventions. And again, just overall tailored QI coaching and intervention strategy. So again, we have sites that often come to these office hours that have never done anything like this before. And so they really get one-on-one personalized coaching and technical assistance of really kind of getting primed for quality improvement work. We've got amazing resources in terms of quality improvement strategies. Often we will meet with sites multiple times where they're like, hey, I just got my login credentials. I don't even know where to start. How do I get started doing this? And we will meet with them and we'll say, hey, you know what? Get signed in, do the training modules. Then it's about maybe 3 videos of total of 45 minutes. We ask them to enter in a baseline data of approximately 30 charts. Once they have that information, we invite them to come back to office hours and we can take a look at that information and take a look at, hey, what's going really well at your ED and where are some areas for improvement that will really help you meet that bar of higher pediatric readiness. And so then from there, we can really launch into resources that are available. We can provide access to intervention guides or clinical bundle guides, or if you want to be working on pain assessment, if you want to be working on abnormal vital signs, if you want to be working on suicidality, we have resources so that you don't have to think about how do I even do this? We've got the step-by-step process of how you start to do all of these things. One of the nice things too that I really like about NPRQI is that we really embody three tenets. The first one is to measure. So when you enroll in the platform, you get access to these 28 nationally vetted pediatric measures. And again, they're the most common clinical conditions that include things like respiratory distress, seizures, and suicidality. The data entry is simple, it's streamlined. You can enter de-identified patient data through the secure platform, that it's accessible by any registered team member. And again, you don't need any training to do this. It is manual data entry, and we were very intentional about that because, again, we were really targeting low pediatric patient volume sites and low resourced sites, understanding that many of these sites are not going to have the most technologically advanced resources and capabilities. We know that a lot of the high pediatric patient volume sites, the children's hospitals, they have access to these types of tools, but they also have to pay thousands and thousands of dollars to participate. So we really wanted to help level the playing field for the lower pediatric patient volume sites and allow them to really work on their pediatric performance and implementing quality improvement strategies. So once they've entered in that data, they can really reflect upon that data. They can analyze the data using interactive dashboards that really track performance and help a site to identify trends. You can compare your ED's metrics to other similar patient volume metrics. So if you're a low pediatric patient volume site, you're probably really more concerned about what are other low pediatric patient volume sites doing? How are they performing on these specific measures? And then you can also benchmark against the national performance. And again, all of this is confidential information. When sites log in, they can only see their site's data. And each user gets a secure login for the data portal and the dashboard. And again, using that information where you can actually download these images into PowerPoints. So I'm sure many of you all probably make report out or provide presentations to quality improvement committees, to your ED leadership. You can download these data visualization tools and really make the work that you're doing tangible to people so that they can really understand what the data is saying about the pediatric care at your specific ED. So again, you can share those insights. You can use that information to help, drive buy-in. If you don't have a PEC at your site, you can use this information to say, this is why it's important that we do develop this role so that we can get improved performance on the most foundational care processes for children that are seen in EDs. And so then again, ultimately being able to improve, turning those insights into action, implementing those evidence-based changes that have been informed by data, and being able to track your impact in real time. And then ultimately being able to facilitate and sustain long-term excellence. So being able to leverage data to develop a comprehensive pediatric quality improvement plan that's supported by resources, guidance, and collaborative work. So we do have a couple of communication resources and marketing products. We'll be posting some of these in the chat as well. If you are not part of NPRQI, you've heard of NPRQI, you're kind of interested, but you're like, oh, how do I get somebody at my ED to pay attention and get involved? The ED Leadership and C-Suite Promo Package really already has ready-made messaging that you can just copy and paste and send it off to your QI director or send it off to whoever you would want to share that information with. We've got our NPRQI website that's been newly revamped. We'll put that in the chat as well. And then we have additional resources just for infographics. We'll post those in the chat as well. Those are easy to attach to an email and share or print out and just kind of lay around in the break room and let people kind of see those as they go in to grab a snack. What questions do you all have about any of this information that we have shared today? I know that sounds like a lot. I see some familiar names of folks that have access to NPRQI. You are more than welcome to share any of your experience about using NPRQI, how it's helped your specific ED, or if you have questions about getting started, we'd be happy to answer those as well. And if you haven't gotten started, we've got a QR code here that can lead you to the registration link. And then getting registered is the first step really to getting better data, making better decisions, and ultimately getting better care. What questions do folks have? You are free to enter that in the chat, or you can unmute.
How many of you guys collect or look at any pediatric data right now? You can just put it in the chat if you do or you don't. And for those of you who do, what type of things are you looking at? If you don't mind sharing. Good.
Timely vital signs.
Yeah.
Yep. Several of those. Somebody put steroids to asthmatics timely. So one of the measures for NPRQI is time to intervention. You can actually measure that. You can document it and measure how long did it take for us to administer an intervention, to administer medication or fluids to a pediatric patient. Length of stay, we also have measures that also measure length of stays and really provides EDs an opportunity to kind of dive deeper into that. If the length of stay is really high, really kind of begin analyzing what are some of the contributing factors for that. It looks like Crystal just posted a link to the NPRQI measures on the NPRQI website. You can take a look at those.
You guys are doing some great things, especially
Yes.
pain assessment. People don't think that sometimes kids don't have pain as much as adults.
Right.
Or it's just not even thought about when they come into the emergency department.
I'm gonna bring that up real quick and see. Move this up.
You guys are doing good work.
Can y'all see that website or no?
Yeah, red cap.
Okay. Oh, no, sorry, wrong
That's
one.
red cap. That's why
It was sharing already. Sorry. Okay, there we go.
There
Yeah.
you go.
So this is the NPRQI website. This is, yeah, these are the measures here for the breakdown. So we've got assessment and the specific measures for that, interfacility transfer, blunt head trauma, seizures, respiratory complaints, vomiting, and suicidality. So all of those things you can take a look at. You can get, visual analysis of how your site is actually performing on any of those specific measures. I did want to share too that if you are looking for some additional opportunities to engage in pediatric readiness, one of the ways is the NPRQI Monthly Forum. We host them on the first Wednesday of the month. Next month will just be all NPRQI, really kind of doing a deeper dive, giving case studies on how to actually use the platform and the interventions. We also have a community of practice that are made up of past Pediatric Readiness Collaborative participants. That's going to be happening in September. There should be a link in the chat about that as well. So that's another opportunity to engage as well. Crystal, can we get you may have already posted it. Can we get the record entry form for NPRQI posted in the chat? That's a list of all of the questions in the data portal. And if you're not using NPRQI, just wanted to share that NPRQI really looks at all 4 phases of care. We're really looking for whether or not certain things were done in each specific phase. It's a limited data set, so we do not capture name, we do not capture date of birth, and we don't capture medical record number. The only potential PHI that we capture is date and time of arrival. And those are there because we have specific measures around that.
Anybody have questions about data or what to collect or where to start? Looks like most of you have already started, which is
Which is
great.
great. Yeah. I just put my email in the chat in case anyone has any questions about NPRQI. I'd be happy to answer any of those. Please feel free to reach out via email. We don't have any other questions. Happy to give back 20 minutes to your day. Thank you all so much for participating in today's forum, and we hope to see you next month.